All right, everyone, we are going to go ahead and get started. Thank you so much, students and our alumnus, for joining our first Alumni Lecture Series. I am Jillian Pryor, and I am the Assistant Director of Alumni Affairs here at the medical school, and I also sit on the communications team, and I am the person that sends you a million emails. So thank you for registering and joining us today. These events, the purpose of them is to give you an opportunity to learn about the career paths of some of our most accomplished alumni and help navigate different career paths within medicine, not exclusively academic. This lecture, as well as future lectures, will also give you the opportunity to ask candid questions, and I encourage you to do so and take advantage of this unique networking opportunity. Today's lecture features Dr. Robert Palumbo, an alumnus from the class of 1986. An orthopedic surgeon by training, he is nationally recognized in sports medicine and specializes in sports-related injuries. He's served as a team physician or physician consult for the U.S. Women's National Soccer Team, the Philadelphia Phillies, the National Football League Players Association, Walt Disney, the Orlando Ballet, and Cirque du Soleil. And Dr. Palumbo was also the founder and president of OAA Sports Medicine and is affiliated with Lehigh Valley Hospital. So I am happy to turn it over to our guest speaker. And please, while he's giving his presentation, you can submit questions via the chat and they will be answered afterward. And I also really encourage you, once Dr. Palumbo is finished with his presentation, to turn your videos on and ask questions in that way. So without further ado, I am turning it over.
All right. I'm going to just share a screen here for a second, see if I can get this working. All right. I hope you can all see that. Well, thank you. It's really an honor to be with you guys today. Jillian, I appreciate the introduction. Here we go. So as Julian said, I am an orthopedic surgeon, and I'm a sports medicine and cartilage restoration specialist. I have the pleasure and honor of teaching residents, fellows, and medical students throughout my career. I am proud of our nonprofit foundation, OA Sports Medicine Foundation, which really is for the purpose of research and education. And I've been scientific advisor for a lot of different organizations, and I'm currently working with several companies on stem cell and cytokine development, physical therapy devices, and medical supply distribution. So what are we talking about today? We're talking about orthopedic surgery, and the thing for me is that I went into medical school with blinders on. I absolutely wanted to be an orthopedic surgeon. I actually knew I wanted to be an orthopedic surgeon since I was 12 years old. And guys, that's a long time ago. I'm old. I was 1972. There wasn't even an American Orthopedic Sports Medicine Society at that time. So, sorry about that. So why would a 12-year-old kid, whose parents, by the way, were told I'd be lucky to graduate high school, let alone stay out of jail, why would I decide at some point to become an orthopedic surgeon? Well, it's because between the ages of 10 and 12, I was treated for a congenital right hip problem. It required 2 surgeries and about 4 months in a wheelchair and about 6 months on crutches. So, sorry. We were told by multiple physicians prior to the surgery that I'd be lucky to walk without a limp when it was all over, and sports were probably out. Now, my involvement in sports was about the only thing keeping this dyslexic, hyperactive child from exploding. Sports was my only love, and really my parents' only hope to keep me somewhat under control. But after multiple opinions, I finally met Dr. Tom Altsizer, a sweet, confident, Duke-trained orthopedist. He took a look at me and he said, "Robbie, if you listen to me and give me 2 years, I'll get you back to sports." So sure enough, my first surgery was December of 1971. My second was December of 1972, and I actually got back to Summer League Baseball in 1973. And that's when I knew absolutely that I was going to be an orthopedic surgeon. And I really never changed my mind. Now, I played football and wrestled and eventually gave up baseball for track in high school. I ended up doing pretty well in high school, and I was actually recruited to play football in college. Now, I was lucky enough to be recruited by a lot of really good schools. And eventually I was admitted to every Ivy League school being recruited. Now, I'm saying that, guys, I understand. It wasn't because of my brains. It was because of football, but I did get to go. Ended up going to Cornell University because I knew I wanted to be an engineer, and Cornell had a really good engineering program. And I wanted to have good background for research in orthopedics. And even back then I thought, okay, I'm going to Cornell, I'm going to be an engineer, and then just go right into med school just from there. So I played football, started for 3 years while double majoring in chemical and biomechanical engineering. Now, the fall semester of my junior year, I was taking thermodynamics, and it was at 8:00 in the morning. I'll never forget. And I'm sitting there trying to understand everything and killing myself, knowing that I had football practice that afternoon. All my classes during the week had to be done by 2:30 because of playing football, and that was both fall and spring. So I'd get off the field, and I'd just be exhausted, and then I have to do my work. Now, the good news is I had all my prerequisites done for medical school by the time I was a junior. But I was leaving parties on Saturday night really early to get some sleep, to go wake up and walk over to the stacks at the library. That's right, we used to study in the stacks of the library on Sunday mornings. So during my fall semester that junior year, I went to see my advisor, and he told me I already had the courses I had taken. I was good for my prereqs, and I could take a couple more courses, and I could graduate from the arts and science school with a BS in animal physiology and anatomy and a minor in endocrinology. And that's what I ended up doing. I had 100 credits after my fall semester of my junior year, and I really only needed 120 to graduate from the arts and science school. And most of those happened to be requirements in the artsy side, not the science side. Those 3 semesters I had left were a lot of fun, maybe too much fun. My QM actually dropped a few points after leaving engineering, but it was definitely worth it. So I got into Rutgers Medical School. And listen, guys, after not matching my first time in orthopedics, I did get my orthopedic residency and went on to do 2 fellowships, one specializing in sports medicine and the other in sports foot and ankle surgery. Now, finally, at the age of 34 and with a wife and 3 kids, I got a real job. I was supposed to come back to Rutgers and join University Orthopedics. However, during my chief year, my best friend and chief resident, Bobby Ochner, that's him on the right up there, Bobby was killed by a drunk driver coming home from the ER one night after being in the ER helping a junior resident getting through things. So I knew I could never come back and be there and be at the same spot. So we ended up taking a job in Orlando, Florida, and we decided to be close to our parents who both retired there. Now, Orlando, I didn't know this, but it did end up being a great decision for family and practice. I've been blessed with my whole career to step into some great situations. Orlando is the home of a lot of professional athletes and performance artists. And because of my unusual background with fellowships in both sports medicine and foot and ankle, I started seeing a lot of dancers and performance artists at first. As a matter of fact, that big rabbit in the middle there was my first ACL reconstruction. The poor guy was running down the park chasing a kid, and he wrapped his foot around a pole and twisted it and shredded his ligament. I thought that was a pretty funny, when he told me the story, it was hard not to laugh. It really was. So then I started seeing a lot of professional tennis players and golfers for foot and ankle problems early on. It was a big area where these guys lived and trained. The word spread, and I got seeing a lot more other professional athletes in the area. And when they found out I was also a shoulder, elbow, and knee specialist, I just moved up the body from there. I was first asked to take care of the Orlando Bears 2 years after getting there. This was the Cubbies AAA affiliate in Orlando at that time, and that's when my career in baseball medicine started. Just after that, I was asked to take care of the U.S. women's national team. The team was doing residency just outside of Orlando. Just to be clear, I really didn't know a lot about soccer at that time. I was a football player. Maybe I covered a few games in residency. And I really didn't, had never really taken care of a team like that before. So my mentor told me, hey, listen, they just won a gold medal at the Olympics. And it's a fact that I really had no idea of. This was 1996. And during the Olympics in 1996, really one team stood out. And for those of you who are old enough to remember, the 1986 was the Dream Team in basketball, and they just smashed everybody and won the gold medal. Now, if you're talking about women's sports, everybody knew about U.S. gymnastics. U.S. gymnastics won the gold medal as teams and a lot of individual gold medals. And this is the team that you really thought of, and you didn't think of gymnastics. I mean, you didn't think of soccer, but it was one of my mentors who asked me directly to take care of these guys. So I really had no choice. I remember the first time going to the fields to watch practice. It took about 5 minutes, and I started to see that this was not just a group of women athletes. They were really badass, real badass. So I remember going to the field, they were screaming for the ball. They were going in hard for tackles. They were kicking the crap out of each other. And this was an inter squad scrimmage. It was amazing. They were busting each other, pushing each other. And I found myself really being drawn in at that first day. So I walked over to the coach, Tony Del Chico, and introduced myself. And he just looked up at me and said, hey, Doc, you really ready to take care of these guys? I hope you know what you're getting into. And he smiled, and I just headed towards the locker room. We looked like any other locker room and training room. I've been in many as a player, as a resident, and as a fellow. And I've covered a lot of women athletes, covering colleges during my residency and fellowship. But this was on a whole different level. It didn't take long to figure out that these were some of the best athletes I would ever have the honor of taking care of. So it didn't take long, but soon after I started working with the team, I started traveling with the team several times a year. I would get to know the team and staff real well, and I would always consider this 10-year period to be one of the highlights of my career. I had the opportunity to watch this team go from a fairly unknown entity to one of the most well-known women's team in sports in the world. It was really cool, and we had a lot of fun. Well, along the way, I became a second opinion physician for the NFL Players Association. I helped form the medical advisory committee for Mike Ditka's Gridiron Greats Medical Fund. I took care of a lot of professional dancers and artists from all around the world, and including the Orlando Ballet and Cirque du Soleil. And at that time, a lot of the athletes and performers from the Cirque du Soleil from all over the world would come to see me in Orlando. Now, unfortunately, or fortunately, my life got really crazy. I was running around the world. I was traveling. I was doing all these things and trying to hold together a practice. And I was really rarely home. And you can get caught in that loop. It's not an unusual thing for guys in sports to get caught covering a lot of things, because it's what we love to do, and B, it's what you almost need to do as a sports medicine physician. But my life got really crazy. And I remember one particular time I was actually in London, and I was working on a deal with the English Premier League to bring them to Celebration in Orlando, where I worked, to take care of them and rehab them there as well. And I was actually it was a great opportunity. I was in the president's box, watching Arsenal play Manchester United, which for me was the biggest soccer game I'd ever seen at that point. But after the game, I called home and I found out that my oldest hit his first Little League home run and I missed it. That was a real wake-up call for me. And my wife and I decided that we needed to get some control of our lives. And so we had to make a change. So an opportunity presented itself to come back up north and develop an orthopedic and sports medicine campus that would have access to best physician care, physical therapy, imaging, and sports performance in the whole Eastern Pennsylvania. Soon after, I was asked to become the head team physician for the AAA affiliate of the Phillies, the Iron Pigs, even before the name was figured out. I've been one of the Phillies team physicians since that time, covering spring training, which I just got back from, and games in Philly. And I started a new role. I was the first physician to start going down to our Phillies Dominican Baseball Academy, which has been a real cool experience. I go about 3 or 4 times a year, and it's been thrilling to see some of our really young prospects before anybody else does. Now, through it all, I've been blessed with a great wife. I could not have done any of this and have done and enjoyed my professional and personal life without my exceptional wife, a former lawyer and mother of 4 wonderful boys. As she would put it, I'm a doctor and she does everything else, which is true. I admit it. It is. It's true. Now, over 30 years of orthopedic training, research, and practice, I've seen so many innovations that have changed the course of our specialty. More than any other specialty, orthopedic surgery is dependent on engineering principles and innovation. When I started, attaching a camera to the arthroscope was early and just coming around. Prior to that, they were literally looking directly through, not very sterile. Now, irrigation systems were not even around. We just hung bags of saline and let gravity do its work. Now, I was so fortunate to be a young physician at a time where all these new techniques and devices were coming on, and all these new biomechanical devices were able to test different materials and create different materials. And I've been in the middle of that my entire career, and it's been very cool. I've been fortunate enough to work with some of the big orthopedic device companies like Arthrex and Zimmer Biomet and Lab, among others. My whole career, I've seen the process of all these companies making different equipment. And I've been part of the process of going through the concepts from production to trial for a lot of things. I'd love to discuss the designs with engineers and giving them a surgeon's perspective. And now, biomaterials, biologics, stem cells, cytokines are all part of the new wave of medicine. And I'll tell you, orthopedic surgeons just love toys, and they love new toys and any new devices and things that come to it. Now, the field needs a whole new generation of orthopedic surgeons to develop and use these new tools and develop these new tools. Now, I really hope some of you guys are going to be part of that really brings it to the next level, and with the next introduction of biologics, a lot more. I always told my partners that are total joint specialists that my job was to make their job obsolete. And I truly believe that we're on the cusp of really creating devices, creating science, and we're catching up with the biologics that are really going to be game changers in your generation. Maybe a little late for me, but I guarantee it's going to be a huge thing for your generation. So I'm really excited for you guys. And I hope you guys take part of it. Now, as an epilogue, just to let you know, you guys, full disclosure, I am now suffering from a cervical myelopathy, which means my cervical cord in the center is kind of dying for a couple of reasons. One being football. I've had 18 football related surgeries since I played, and this is me now. I'm fused from C2 to T2 in my neck, from L2 to S1 in my back. Both my knees have been partially replaced, and I have a right total hip. So while it's given me empathy to take care of my patients, it's also one of the things I feel that is my responsibility when taking care of athletes is, protecting them from themselves, protecting them from their coaches and from their agents. And the line I usually use is, I don't want to be their ghost of Christmas future, because of all the things that I've gone through. And a lot of this stuff should have been preventable. When I played, the head was a weapon. Myself and a lot of my friends are paying for that now. So it's what's kept me in orthopedic surgery, even though I can't operate on my own right now because of the dexterity in my fingers. I'm hoping that my last surgery will help that. I'm a big proponent of stem cells. I was supposed to have a trial of that before COVID started, and I'm looking forward to going to try to do some intrathecal stem cells. So there's a lot of things along the way. I am teaching more. I'm trying to write more now, but losing surgery is a big loss, and it's kind of hard. But I just want to let you guys know, full disclosure that that's what I'm dealing with right now. But I still love orthopedics. I'm going to stay involved in sports medicine forever. If that means just covering training rooms and clubhouses, I'd be okay with that. So with that, if you guys have any questions, I'm here to answer them. I'm very happy to talk to you guys. As you can tell, I'm not scared of talking. I usually get the red light when I do presentations or talks at meetings. So I hope I didn't go over, and I appreciate you guys being here. So any questions you have, let me know.
And feel free to take yourself off mute and ask in person, or you can fill out the chat.
Okay, Dr. Palumbo. My name is Matt Nazar. I'm a third-year student. Thank you for talking to us and giving us the whole presentation. It was really great. I had a question about getting involved with teams. I personally think I'm most interested in sports medicine, and just wanted to know if you had any advice on how to, proceed with trying to follow that up, if it targeting certain programs.
Yep.
When I apply.
Well, the best thing about sports is that, there's a lot of approaches to it. As I said, I didn't match with orthopedics the first time out. I played it very poorly. I only listed a few. It was a different time back then, and I was poor. I didn't have a lot of money to run around for interviews, so I really only listed about 4 programs, and that was done. But my backups were either doing sports medicine through PM&R, physiatry, or through family practice. We have 5 surgeons in my practice and 5 primary care sports medicine fellowship trained docs. And the key is not your residency. In your residency, if you're going to go to an orthopedic surgeon, you want to find a residency where you're going to be, it's a very clinical residency. Okay. Now, certainly going to HSS, in Penn, Harvard, you'll get great fellowships out of that. The problem is you won't get a lot of good training out of that surgically, because you'll be the third in line. There's always fellows. And so one of the things I would consider, if you want to go do academics and you want to guarantee yourself, that you'll be able to get into a fellowship. But when you get to the fellowship, you find that you're one of the least trained. When you get there, go to Harvard, HSS, Penn, those kind of things. But if you want to have a good experience and preparation, you want to go to certainly a good program, but that's a very clinical program that does not have a lot of fellows, okay, and is involved with at least a college or some team, okay, because during your early residency, probably not going to get a lot of opportunity. although things have changed. Our average work week was about 120 hours a week. With 80 hours a week, it's a completely different situation. And and even though it's technically part of your 80 hours, you'll be able to do, I would really recommend doing research with, or help them do talks or help them do presentations, meet the guys that actually do sports medicine in the program. And, and really it's all about a love of the whole thing. You got to love everything from covering local marathons and triathlons to covering professional teams. You got to love all that. Okay. I could tell you my experience after fellowship, when I got to Orlando, taking care of the amount of performance artists, gymnasts, Cirque du Soleil, acrobat, dancers, ballet. I learned so much more that I translated to more of the common sports, baseball, football, basketball. I learned so much more during those first couple of years in practice because of what I got involved with when I got down there. I was lucky. I had a unique combination, and I was just right away started seeing those people. And but the other thing is, when you never say no, if somebody needs you to cover something, got it. If you got, and especially early on, I was covering something probably 3 times a week. I was just, whoever needed me, wherever I could volunteer, I was there. And get yourself out there, meet people, be involved. You could now, you could be a volunteer at marathons now in the medical tent, those kind of things. Once things open up, you could go, work with University Orthopedics and also the guys at Rutgers that take care of the team and see what there is available for that. But that's kind of how, that was a long-winded answer to answer your question.
It was great. Thank you.
Okay. Anybody else? Come on, you guys, opportunity. And I will give you guys my email, so you can always contact me. I love Rutgers Med. I have a lot of great friends and a lot of great memories, and it did me well in going forward in residency. So my email is, if you want to write this down, and I know Jillian will get this to you, it's ESPN Sports Doc, ESPN SPORTS @gmail.com. So you can contact me if you're a little camera shy right now, or you don't want to ask any questions right now. I get it. But if you have any that you want to talk about, happy to talk to any of you guys if you just contact me. Any questions, Jillian?
Hi.
You guys are a quiet bunch. Come on.
Hi, I'm Jacob Daslov. I'm on a research here now. And I was wondering, you've had a lot of different phases to your career, so you're probably one of the best to be able to answer this. Can you talk about what your balance, like week to week of spending days, your balance week to week of doing surgery versus like being in the clinic or being on the field was during these different phases?
Yeah. Well, like I said, residency and fellowship were crazy because, again, our average week was about 120 hours a week. And that didn't include studying, that was just in the hospital, in the clinics, on the field, and so during residency, I was lucky. I was here at Robert Wood at the time, and we took care of an orthopedic residence and took care of Princeton and Rutgers. And because I was a Cornell guy, I worked with Dr. Joe Zawatsky at Princeton. So I would be down there at least once a week for a training room, which was a few hours, and then during football season, I was at every home game. Okay. And then some wrestling matches, some other things, some tournaments that I have covered. But that was residency. And, but when I became a fellow, I think we figured out we averaged a coverage about one for every 2 days when I was a fellow. So we were operating at that time probably 3.5 days a week, and in the clinic, because we worked on Saturday mornings, about 2 days a week, 2.5 days a week. So that was during fellowship, and that was for both. Because when I got to Houston for my foot and ankle, it was really for the sports side of it. So I was doing a lot of, because I was already sports trained, I was still doing some sports stuff when I was down there. But I was also doing all the foot and ankle marathon. We took care of Santa Monica Running Club. We took care of, most of the Major League Baseball foot and ankle injuries, because Don Baxter was there, who was my mentor, was their kind of general consultant for foot and ankle problems. So we saw a lot of really cool things in the clinic. That was mostly sports related foot and ankle problems. So that really set me up. Now, when I got to Orlando, fortunately back then, working 80 hours a week wasn't a big deal because I was coming off 120 hours a week. Well, it was hard though, because I was pushing it. I was trying to get involved with whatever I could. And I was, like I said yes to everything. And, I had 3 boys early on, and I had a 4th, later on. And it became crazy. I mean, I'd be away for 2 weeks at a time with the national team. I'd be presenting at meetings at least 3 to 4 times a year. I was doing research with the residents down there. And so I was busy. Now, I loved it. It was my fault. It was my own doing, but, and the problem is it could pull you in. Okay. Because the more you're doing it, the more people want to see you, and the more you don't say no. You're ending your clinic at 7:00 rather than 5:00, and you're getting there at 6:30 in the morning to get the athletes that need to be there before practice, whatever, and so it really got crazy. And that was that was the turning point when I told you about that, that time in England. Listen, it's definitely an ego thing to do what I was doing. I admit that. I was young, I was cocky, and I thought I was the one. But you get blinded by that, and you got to be careful about being blinded by that. Now, in sports, you have to do extra stuff. It's not like doing total joints where you're either in the operating room or in the office, and then you're home. And it's a very scheduled life. Same thing with spine. A little different in hand because a lot of emergencies in hand. But for general, you're in sports. If you want to do sports, you have to be out in the community. You have to be, and you have to involve yourself with as much as you can. So in sports medicine, everybody I know who's good, and all my friends that I grew up with that are now heading programs and stuff, we all did the same thing. We did not say no. And it really took its toll on a lot of my friends. A lot of my friends have been divorced a couple of times. I'm fortunate, to be married for 35 years, because Joanne is unbelievable and she puts up with a lot. But I also made that decision at 42, 43, to 44, to change my life. Okay. And it wasn't easy. I came out to Pennsylvania because they wanted to build a campus similar. I helped develop Celebration Health, which is Disney's planned community, and they have their own hospital down there. And I helped plan the whole orthopedic and sports medicine program there, and PT and everything like that. So I had a lot of background in building campuses. So I came up to Lehigh Valley. We have a 350,000 square foot campus, of which we have about 150,000 of it. But when it started, it was just to make sure we had everything under one roof. And and it was great, but the plan was maybe stay, for 6 years after it was done and then move on to do something else. I really wanted to get back in academics, but again, I got so involved with things in the Lehigh Valley, and it was, what was beautiful. I was taking care of my kids' high school, and so I was on the field every time they played sports. So that was, and you became and to be a community doc was almost better than taking care of the pros I was taking care of, because that's business, that's work comp, that's, there are a lot of issues there. When I was, say, on the sidelines of the high school, it was like I was Doc Palumbo, I was Doc P, and I'm still Doc P to half the people in town that just come up. It's a really good feeling. So that was a way of getting balance. I had to kind of change my whole approach. Now I'm still involved, but it's kind of on my, on my terms. I mean, I love baseball and I love baseball medicine. I just love the biomechanics and everything about it. So when I started taking care of the pigs and then also the Phillies, that was worth a lot of my time, because it really satisfied, a lot of things. And because the way our clinic was, I was able to see a lot of patients, a lot of my second opinions and pros and NFL Players Association stuff I see at the office, and that's not a big deal either. Sometimes I have to stay later or come in on a Saturday, but not a big deal. So my life is a lot better off now. Over the past couple of years, when I lost my dexterity in my hands, I had to give up surgery. I do assist. I have a couple of young partners that are now taking. I used to do more of the complex sports stuff, the revisions, and a lot of the articular cartilage work and hip arthroscopy. So now I'm kind of training two of our young sports guys to kind of take over those cases. So at least I could assist, and I could get through that part and help train them. And I still do training in cadaver labs down with certain products I'm developing and things like that. So I get to do that, but I've always said I won't go back to surgery until I can operate on one of my kids and feel good about it. So we'll see. Still working, but I'm fortunate enough where the other parts of sports medicine are so cool, and I love, and I just, one of my favorite places to be is in a training room, to working with the athletic trainers, working with the players. And it's just, I feel comfortable there. And that's why I said, it's not just orthopedics. If you're interested in sports medicine, it's PM&R and family practice, and do your fellowships. And actually, I just, right before this Zoom meeting, I was on WhatsApp, texting back and forth to the Dominican, to the trainers down there. They had a kid, and it was something about his eosinophils, and I said, let's get the real doctors involved. And so when you have family practice or PM&R guys that are real doctors, you can ask them those questions. And let me tell you, traveling with 24 women for 2 to 3 weeks at a time, a lot of it was in orthopedics. And I had a lot of books with me that to take care of all the other stuff while I was. I remember a lot of my sports. I've not only taken my board in orthopedics and sports medicine, but I also American College of Sports Medicine and the American Medical Sports Medicine Society. I've taken their classes and courses too, because if you're really involved, you got to stay up to date. But I'm fortunate to have some real doctors around me to take care of that stuff. Anybody else? Come on, guys.
One that came in through the chat was, what was your favorite team or favorite sport to work with?
That's really hard, because I've been really fortunate, but I have to say my time with US Soccer, and I'm still a consultant with them, but my time traveling during that time where the US women's team really just became a phenomena, And just becoming friends with, when I first started, I wasn't much older than some of the players, and I've stayed friendly with all those guys, and that's been a lot of fun. That I have to say that if I had to pick one, that was it. But taking care of baseball and being in the clubhouse, and my first year with the Phillies, we won the World Series. So, and I keep reminding of that they can't get rid of me because of that reason. But being during that run and being in the clubhouse and being actually in, being the assigned team position during some of those games was a lot of fun. A lot of fun. I've taken care of a lot of bowl games when I was down in Florida. I was medical advisor for the Orange County Sports Commission, which had all the bowl games down at the Citrus Bowl, and I've been pretty blessed. But all in all, long answer, I would have to say U.S. Soccer national women's team. Anybody else?
And people can feel free to use the raise hand too, if that's easier. I think sorry, I cut someone off.
Yeah, no problem. Hi, Dr. Palumbo. Jason, I'm a fourth-year med student. I'm actually going to be an intern at Robert Wood starting in July as well.
All right.
thank you for coming to talk to us. And I guess I was wondering if you could just elaborate a little bit more on how you first established that rapport with the large-scale organizations like the U.S. women's soccer team, for example. I know you touched on, never saying no, and I was wondering, did you reach out to them first, or how did that relationship come to be?
Well, I would seek out, when Disney started their marathon, I was there, and I just went to Florida Hospital at the time, which is now Adventist Hospital, who was sponsoring the race. And I said, I knew some of the trainers there that I had been working with from the local teams. And I said, hey, do you need somebody in the orthopedic tent? And they said, well, we don't have an orthopedic tent. I said, well, maybe we should have an orthopedic tent. And sure enough, we had a medical tent, an orthopedic tent. And for 7 years, I was the lead orthopedic surgeon in the ortho tent. But the other thing is very important, reach out to all the athletic trainers. First thing I did when I came back up north, I started the foundation, and the first use of that foundation was putting on a yearly clinic, a yearly talk for our athletic trainers and physical therapists. And we had about 120 participants every year, and they came from all over the state, and including, and also we're adjacent, real close to Jersey and New York, and so that was the way. You want to present yourself as the specialist. And listen, almost every trainer in the area, let alone across the United States, has my cell phone. Okay, and I could tell you, there could be a call at 2:00 in the morning because somebody got hurt on the West Coast, and my wife would answer the phone and say, hold on, give me the phone. That's how good she was, so, and so you put yourself out there in a lot of different ways. Like I said, one of the best ways is through the athletic trainers at the schools, okay, and throughout the community. Teach the physical therapists, because they know the good surgeons and bad surgeons. And if they are having a problem with the doctor, then they suggest, hey, you may want to see Doc Peak just get a second opinion. And there's a lot of small things around. There's a lot of small groups. I used to talk at YMCAs. I used to talk, especially back then, and maybe a little less right now, it was the mothers that controlled all the healthcare of their kids. Okay. Fathers had very little to do about it. So I used to find ways to give talks to moms. One of my favorite talks to give was about protecting little leaguers, okay, from injuries, because I can't tell you how many baseball players' careers are done by the time they're 15 because of overuse or trashing their elbow or trashing their shoulder. And so the moms are the ones that will take their kids off the mound. It's not the dads. Back then, it could be completely different right now, but that's how I start off. So I'd find ways to talk to the moms. Now video podcasting is all there. You could be part of that. It's a way to develop your own mailing list too. So, you ask people for their connections and you just send out newsletters and things like that. So there's a lot of ways, especially now. And you guys are much better equipped than I am. Okay. I'm 61 years old. I'm trying to do all this, podcasting and video podcasting. In fact, it looks like I might have a show on Sirius Radio soon. So, so those kind of things are ways of getting out there, and the most important thing is to be a person with your patients. My best referral is other patients, and that includes, my professional guys. I mean, it's not, NFL, my NFL second opinion work, Players Association work. Yeah, I have a name in a booklet that people could look up as one of the guys, but really it's now after, 27 years of taking care of him. It's the agents that know me, and those are the guys that will send things directly. They don't go through the NFL Players Association anymore. So it's just a question of being involved with your patients, loving what they do, learning the sports that you're taking care of, learning the injuries of wrestling, learning the injuries of track and field, learning the stuff that nobody else really thinks they care about, besides, some of the big four sports, because all of that will help. Every injury I see helps me with somebody else, and like I said, if you treat people without arrogance and with empathy, they'll just start sending you people. That's what they want. They want somebody that listens and somebody that understands. And you need to know all the therapists in the area, okay? Because I don't send to places when I send to therapists, and vice versa. They do the same for me. So you need to be involved with that level of healthcare professional as well. I mean, really, most of my friends and my colleagues I would consider are not physicians. It's more of the trainers, the physical therapists, the coaches, because that's the level I want to be on. That's the level you need to be in sports, so I hope that answers your question. That's kind of, how I got involved and how you get involved. It's just a question of being there. Now, again, and I think you guys are learning this better than my generation by far. You do have to have a balance, but I will tell you, if you want sports, if you truly want sports, you're going to be working harder than your partners. If you go into orthopedics, or if you go into a family practice, where you're the sports guy, you'll be working harder, because you'll be working just more hours, because that's part of what you do. You need to be in a training room. You need to be your weekends are not always your own. So that you just have to know that going in, and, have a partner that understands it. That's important as well, but get that balance. And it took me a long time. My wife would say I'm still learning, so, but it's absolutely worth it. Absolutely. I mean, when I have a lot of my ex-athletes, especially it seems to be my gymnasts a lot. I take care of an Olympic training site here. And so a lot of my athletes go on to either a national team or high-level gymnastics teams in college. And I tell them all, they so many of them go into medical field because of injuries they had and the experiences they've had with the trainers, with me, with everybody. And my biggest, when one of them gets into an orthopedic residency or a sports residency or sports fellowship, it just makes my heart really just sing because they, I know I've been part of it, and I'm in contact with all of them, and it's really cool. It's really cool. So that's my life is full because I get a lot back from my patients, and I have patients that are with me for years and years and years. It's not just one thing they see me for and it's off. I take care of them through their careers. After their careers, I now take care of their children. It's like it's a cool. I can't imagine doing anything else. I mean, I did go in with blinders, and that was a mistake in medical school. I knew exactly what I wanted to do. I knew what I liked in medical school. I knew what I didn't like in medical school. And I probably missed a lot of really interesting stuff that I should have gotten along the way. But can't say I'm sorry right now. I'm happy to be where I am. I couldn't imagine doing anything else.
Great, thank you.
Okay. Good luck, Jason.
Thanks.
Hi, Dr. Palumbo. Thank you so much for being here. It's really an honor to listen to your incredible story. And now it seems kind of trivial to ask you such a minor question, but I'm wondering if you could talk a little bit about your work with cytokines and stem cells, since M1s are currently in their immunity block. So
I'm an early adapter. I've used biologic healing techniques for a very long time. I mean, I started early on with prolotherapy, which is really it really came from Russia, and I was actually taught by one of the Russian physicians really early on, and it was because of my involvement with the Cirque, because a lot of the performers at the Cirque were ex national team gymnasts, or acrobatics is actually a competition in Asia and in Europe. And so they were, but a lot of them were either Eastern Bloc or Asian. And some of the stuff they asked for was at the time bizarro to me. I mean, so I started with prolotherapy, which is simply just injecting an area with normally dextrose solution and trying to start a really inflammatory cycle to bring in healing cytokines, healing factors to an area. So that was my first introduction to it. I've been involved with the International Cartilage Research Society since its inception. And part of that has been, we started out with simply cloning autologous cartilage cells, and I started reimplanting autologous chondrocytes in 1997. Okay. So I saw, again, early adapter. I started with Genzyme very early when I was one of the 100 physicians that did the 3,000 patients for the FDA approval. So I was an early adapter with that. We've done a lot of research just from that. The techniques we use now are built on everything we did since that time. Now we could just take a person's cells and we could just build a collagen patch and just place it in. We could do things arthroscopically that used to take us hours to do open, so. And I've always told fellows, probably for the last 15 years, that the holy grail is the stem cell and learning how to control it. And we're now getting there. I mean, unfortunately, Europe and Asia is way ahead of us because of the FDA. There's so many things that we can't do in the United States. And what I tell them, we do biologics in our office. We do BMAC, we do FAT, we do exosomes, we do PRP in our office. But what I tell my patients is that it's really stem cell light. That it's not what we do elsewhere. Okay. Now I'm involved. I'm a medical advisor of a clinic in Medellin, Colombia, and what we do in Medellin, we actually take warfarin jelly and the fetal stem cells from warfarin jelly and some of the other products and incubate them. So we know when we give a treatment there, we could say, all right, and we could develop protocols saying, all right, we're going to give you 1 million cells. We're going to give you 10 million cells. We're going to give you this. We're going to do it here. We're in the United States, we're not allowed to do anything to manipulate cells, which is really stupid because we do all the time. Okay. It's unfortunately big pharma and insurance companies are the rule when it comes to the FDA. But, and it's funny because the FDA equivalent in Colombia, remember, Colombia is a very Catholic nation. And so to even use fetal cells was hard to get through at first. But now we have the first trial of using aerosol and IV stem cells for the treatment of COVID-related pulmonary problems. And so we're in the middle of, it's an ongoing, we just started that about 2 months ago, but it was approved there and it's not approved here, to try that. So like I said, I'm a big believer. I work with another advisor of a company in Tampa that produces exosomes, which basically the signaling proteins. And I'll use that for a lot of my older patients because to take their fat or bone marrow from a 70-year-old osteoporotic woman is impossible. You're just not going to get a yield. And even if you get a yield of the actual marrow juice, the yield of stem cell in that is going to be very low. And I can't tell a person when I do their own cells now if it's a good yield or bad yield, whereas what's coming, hopefully in the United States, is that we'll be able to tell exactly how many cells we're giving, exactly, which IgA, we could, the whole system, we're going to break out and be able to use things individually. And I truly believe by 2030, that's going to be the standard. And I telling my residents and fellows now, I would love to be in your time right now because it's going to be a really cool evolution. And the things that, just the saving of cartilage, the restoration, we use it, we have a protocol now where we'll use PRP with pitchers with Tommy John ligament injuries, ulnar ligament injuries, and about 80% get better, and get back to pitching same level. And that's just using PRP, which is kind of like, really stem cell or biologics light, imagine if we really know what we're doing and know how to stimulate the actual ligamentous bony interface, it's coming. It's absolutely coming. So very cool. And I'm very, it's one of the things I'm most excited about. And, now I have time. So it's really part of where my focus is right now. Did I answer your question, Rob?
Yes, very well. Thank you.
Anybody else? I know this is well, as I said, guys, please feel free to contact me. Happy to talk to any of you guys. We're not open for internships yet because of COVID yet, or little rotations, but usually we are. And I love having, students in the office. So yeah, just let me know. And even if you have any questions about going forward and going through your applications or what you may or may not want to do, as a path to get to either sports medicine or even musculoskeletal medicine without going through orthopedics, let me know, because there's a lot of good ways to get through it. But what I hope you took from the talk is you got to find some balance, which I think your generation is a lot better at than my generation. But being in sports, you are going to be working harder than your partners. So, but you'll love it. You'll enjoy it. It's the best thing in the world. So,
Thank
anybody
you
else?
so much.
All right, there you go.
Thank you so much, Dr. Palumbo, for being our first lecture series speaker. And like he mentioned, I will send out his contact information so that students can follow up with you for any questions.
That's my pleasure, guys. It was great meeting you, at least this virtually way. Hopefully sometime I come and actually lecture in person. So, okay.
Great. Thank you everyone for attending.
All right, guys. Thanks a lot for listening. Bye-bye now.